Thank you so much for being here tonight. We are excited to be here as well to bring you this information in a different platform, but Facebook and YouTube, this gives us a different way to reach more people. And so that's what's really exciting about it. And so I would encourage you to share this talk and this information with your friends and your family members. And I'm going to be sharing my screen with you in just a second so that we can begin the information. But our topic tonight is how to supercharge your immune system. So obviously with what's going on right now, this couldn't be a better topic to go over. And so I'm going to share my screen with you. If you have questions, though, as we're going throughout the information, please drop them below, make comments, and like I said, share this with other people. First, I want to introduce myself a little bit more. If you're not a patient and you don't know who I am, let me share my screen with you. Give me just a second. And so who I am, I'm Dr. Jaime Granger. I practice right alongside my husband, Dr. Scott Granger, and we own and operate True Health Chiropractic located in North Myrtle Beach, and we also have another platform called Wellness Minds. We've been serving the Grand Strand area for over 13 years, and our mission is simple. It's to lead as many people as possible to true health by teaching them the principles of wellness. So every day in our practice, we talk to people about how to maximize their mindset, detoxification, nutrition, brain and spinal health, and exercise. These are all pillars of being truly healthy and truly well. And so tonight, when we go through and talk about how to supercharge your immune system, those principles don't change. They're important all the time. Now, obviously, with what's going on right now, we want to talk about, for one, how does your immune system actually work? Some foods that you need to remove right now that create inflammation. We're going to relate this back to the immune system, the top foods that you need to be eating to boost your immune system, and then some other lifestyle changes you can make to reduce stress on the immune system and make sure it's functioning at its optimal levels. So how does the immune system work? What I want to focus on today is really more the breakdown of the Th1 and Th2 immune response. It's important to know that you have what's called an innate immune system and an adaptive immune system. Your innate immune system is working for you 24 hours a day, killing off dead, damaged cells, and keeping the body protected, keeping the body safe and healthy. The adaptive immune system is important when we're exposed to things like the coronavirus, other bacteria, other parasites. Now, in particular, really what we want to achieve is a balance amongst the Th1 and Th2 response. If you've been listening to the news, hopefully not too much, but hearing things about how the coronavirus in particular triggers a cytokine storm, a systemic amount of inflammation in the body. That's because in particular this virus actually creates and kind of drives the immune system to respond too heavily in a different response. So again, really the key to your immune system, it's supposed to protect you. It's supposed to eliminate what we would call non-self. So things like viruses, bacteria, parasites, cancer cells. That's the whole purpose of your immune system. And that is what God gave us to protect us against different forms of virus, bacteria, and parasites. So again, though, a healthy immune system is an immune system that's actually balanced. That's when it's going to be optimally effective. You can see on this chart when your immune system is actually overreactive, it can lead to not only allergic reactions such as full-blown allergies, eczema, asthma, sinusitis, also food sensitivities, and leaky gut. Two, it can lead to literally where your own immune system begins to attack your own tissues and cells, leading to autoimmune diseases like Hashimoto thyroiditis, rheumatoid arthritis, and even type 1 diabetes. These are different autoimmune responses. Now, if your immune system is underreactive, obviously then that's when the body is going to be more prone to develop cancer, which can be caused by different viruses, and then different types of infection, again, tied to maybe bacteria, mold, parasites, or even viruses like the coronavirus. Again, the point is that things should be balanced in every system of the body, but when we're talking about the immune system, in order to have that optimal effectiveness, we want it balanced. So what creates an imbalance in the immune system? For one, it definitely can be the food that you're eating, so your diet, and different environmental factors, tobacco use, heavy metal burden and exposure, pollutants that are in our air and our water. Gut dysbiosis, what that means is basically your digestive system's not functioning correctly. Maybe you have an overgrowth of yeast or E. coli. Prolonged stress leads to high levels of stress hormones, in particular cortisol, which we'll talk about later. That decreases your immune system. And the overuse of medications. So prolonged use of steroids, excessive use of antibiotics, not just now in your adult life, but also when you were a child, and the growing use of combination vaccines and the adjuncts that are in the vaccines, basically formaldehyde and other chemicals that they use to actually give a shelf life to the different vaccines. So all of these things will create an imbalance in the immune system. And so that's why we want to talk about these things so that we can either remove things, replace, and do things differently so that, again, we can create that balance so that the immune system's not going down that inflammatory pathway. So one of the key things we absolutely have to be doing is supplementing with vitamin D3. And why? Because even before the COVID-19 quarantine placements, the majority of the population was deficient in D3. Again, why is that? Because we can't get this from food. We spend most of our day inside, and when we go outside, we're always being told we need to not get skin cancer and lather ourselves up with sunblock. So we get vitamin D from exposure to the sun. And so we need to be outside, getting exposed to the sunlight, not getting burnt, but you need to get daylight. You have to have exposure to the sun. But again, because most of us are spending our time inside or wearing sunblock or sunglasses and hats and other things that cover up the skin, that's why the majority of the population is deficient. The minimum daily requirement that's recommended for vitamin D3 is 5,000 IUs, which is the equivalent to 125 micrograms. This is the bare minimum daily requirement you should be taking. Now, if you feel like you're coming down with something or fighting an infection, a lot of people will therapeutically dose themselves and take even between 10 and 15,000 IUs. But too, this could all be dependent on your levels. If you've had blood work recently or you haven't had blood work, this is something you should really think about getting tested. It's a very simple test so that we can actually know what your levels are. If you're extremely deficient in vitamin D, 5,000 IUs as a daily recommendation isn't even going to be enough to kind of fill the jar in a way. We don't just want to fill it up. We want to actually have some reserves on hand. Okay. So you can see the link down there below. If you're a patient in the office and you're still coming into the office, you guys know we carry these supplements. We have them in stock. However, if you are not coming into the office right now, there is a way for you to still get these supplements, order them online and have them shipped directly to you, which is awesome. So that link down there below, vitaliohealth.com/doc/J Granger, will take you to the website or the online shop where you can actually then order those supplements and have them shipped directly to you. Again, another reason why we need to supplement with vitamin D3 is because vitamin D actually turns off the inflammatory immune responses. So again, I talked about this earlier and brought this up. This is what they're talking about in particular, that this virus, the coronavirus, drives us down this systemic, meaning whole body, systemic inflammatory response that just goes haywire. And so we don't want to be doing anything that's going to create excessive amounts of inflammation. We obviously don't want to be depleted in something too that's going to help counterbalance the inflammation. And vitamin D does that. So it actually takes your immature T helper cells, switches them to the anti-inflammatory version called the T regulatory cell. Basically a bunch of science that means vitamin D helps you be less inflamed, and that's exactly what we want. So this can be very helpful for patients who have that excess, right? That imbalance in the immune system already. And that's why statistically they're showing that the people that are winding up in the ICU, that need ventilators, and the people that are ultimately passing away from the coronavirus are people with underlying inflammatory chronic conditions. So we want, again, to reduce inflammation, and taking a supplement such as vitamin D3 is a great way to do that. Again, the link is below if you want to order your supplements online and have them shipped directly to you. Please let us know too if you need help. Obviously, when you get on our website, you're going to see there's other supplements on there. So I don't want you to get kind of lost in what's on the site. So if you do need help, please call us and we'll walk you through to make sure you get exactly what it is that you need. And then it even had been said several weeks ago that the former CDC chief actually said that coronavirus infection risk may actually be reduced by, again, making sure that you are supplemented and having good quality, optimal levels of vitamin D3. So other good health guidelines really are the number one defense. You can't change viruses. You can't change the common cold. You can't change the fact that there's a flu virus, a coronavirus. We're surrounded by things all the time, but what you can change is what we call the host, and that's you. So when you are strong and healthy and your body is functioning correctly, that is going to give you the number one defense. So common sense things, guys, like they've been talking about washing your hands, don't smoke, make sure you're eating good food, taking good quality supplements, getting exercise, getting fresh air and sunlight. These are all just basic guidelines that are going to help you really make sure that you're staying healthy and well. These are the 3 foods I want to focus on. There are others, but these are the 3 foods I want to focus on that you need to be removing right now to make sure that, again, you're not taking yourself down an inflammatory pathway. So gluten, bad fats, and sugar. Gluten and wheat. For one, I can tell you right off the bat, when we do the food sensitivity testing, we see a lot of people come back with sensitivities, and some people, a lot of people actually have full-blown allergies to gluten and wheat. These create massive amounts of inflammation, which again are going to weaken the immune system. These are pretty much found, gluten is a protein. It's found basically in wheat products, but basically every bread, pasta, cracker, almost all boxed foods, even some of the supplements that you're taking. Now, this is why it's important is that you take good quality supplements. Just like when you flip over and read some of the labels on food, but also supplements, you'll sometimes see it says it was made in a factory that contained corn, soy, gluten, wheat. So the problem with that is that your product can have contaminants in it. You don't want to be taking supplements just because they're cheap. Because the reality is that if you're buying something out of a big box store, there is no regulation, and the majority of that supplement probably has fillers. It may even have sugar or other irritants in it. Again, so we want to make sure we're taking high quality supplements. Gluten and wheat also trigger the immune response because, again, they take you down that inflammatory pathway. And so they're also then going to raise your blood sugar, which then leads to a raise in insulin and cortisol, both which are stress hormones. Again, when there's a chronic pathway that's being triggered, your immune response is going to be weaker over time. And obviously we don't want that now, and we don't want that really ever. Many people, like I said, have intolerances or actual full-blown allergies to wheat and gluten. And so again, how they trigger your immune system is because it triggers the release of different immunoglobulins, such as IgE and IgG, and again leads to systemic inflammation, mucus production, postnasal drip, etc. So as you can see here, even too, in particular with the coronavirus, we don't want to be eating anything that's going to create excess mucus because that's going to inhibit the ability for us to breathe, and especially with a respiratory virus, that's why that can be so dangerous. Avoid bad fats. So sometimes blatantly when you turn over the product, read the label, it'll say it contains hydrogenated or partially hydrogenated oil. That is a bad fat. Other times, though, you're going to see it listed different ways, such as cottonseed, vegetable, margarine, soybean, canola, and corn oil. These are all rancid oils. The problem with this is they actually literally scar and damage the cell, and that, again, is going to lead into inflammation. Also grain-fed, or if you see where meat says it's grain-finished, again, that's going to be corn that the cows are eating, and that leads to bad fats in their bodies as well, which leads to high inflammation, and that's what we're actually trying to avoid. So we want to replace the bad fats with healthy fats. Things like avocados, coconut meat and oil, extra virgin olive oil, nuts and seeds, free range chicken and eggs, grass-fed beef, wild caught, not farm raised, wild caught salmon, sardines. These are all really loaded with great healthy fats. And there's other key things too when you eat healthy fats. I had said this in a previous video that we had posted, but you have what are called fat and water soluble vitamins. Well, your fat soluble vitamins are A, D, E, and K. And healthy fats, when you eat them, allow you to be able to absorb these vitamins and the body can utilize them appropriately. The problem is the standard American diet, they've been telling us for decades to what? Not eat fat. Stop consuming large amounts of calories. And you can literally go back in time and see that as when heart disease and cancer skyrocketed, when people started getting rid of butter and eating margarine, when they started eating more fake, man-made, laboratory-made foods and oils, chronic diseases actually went up. The other benefit too to eating things like avocados, coconut, nuts, and seeds, they also contain a high amount of fiber. And so fiber is going to be really great, obviously not just to get your digestive system functioning better, but so that you can actually balance your blood sugar and lower your blood sugar, because we don't want to have big spikes in our blood glucose levels, because again, that's going to create an inflammatory response where we will then release stress hormones like insulin and cortisol. Another key supplement would be a supplement with omega-3, EPA, and DHA. Why? Because healthy fats are the number one missing nutrient in a standard American diet, because of what I just said a second ago, that people still believe what they've been telling us for decades, to quit eating fat and quit and eat low calorie, low fat foods. That doesn't work. Okay. So healthy fats are a number one missing nutrient. People don't sit around and eat salmon and nuts and seeds all day long. And so what's crucial about a fish oil is that it actually blocks those inflammatory cytokines. And so it irreversibly creates this binding to immune system enzymes. And irreversible is good in this case, because this means that when your body needs that appropriate immune response, it can still have one. So naturally, your omega-3, your fish oils, are anti-inflammatory. They prevent cancer. They aid in digestion and regulation of blood sugar. They lower blood pressure, lower your cholesterol and triglyceride levels, improve brain function, and actually help fight depression. All things you're seeing going on right now because people, they're not going outside. They're watching the stressful news. Suicide rates are going up. People, again, have chronic diseases such as heart disease, which typically they have triglyceride levels that are out of balance, cholesterol that's out of balance. So again, supplementing with this is key. What's great about our omega supplement is it not only contains EPA and DHA, but it also contains MCT, which is what stands for as a medium chain triglyceride. That is one of the key benefits of coconut and coconut oil. And so again, just giving the body the support that it needs to reduce inflammation and make sure the body is truly healthy. And again, you can see the link below. If you need help ordering anything, again, please let us know and we'll be glad to help you. Avoid sugar. This is key. Sugar decreases the function of your immune system almost immediately when you consume it. So it's especially imperative to avoid sugar, but also too, if you feel you're coming down with something, you need to cut sugar completely out. You want to be aware that sugar is present in foods that you may not suspect, like ketchup and even fruit juice, and check your salad dressings because those things are typically loaded with sugar. If you didn't know that sugar feeds cancer and cancer loves sugar, this is a really great picture off here to the side showing you the difference between a CT scan and what's called a PET scan to look for cancer. When you have a PET scan, they actually do inject you with a sugary dye, and you can see it just literally goes and lights up where the cancer is, because the cancer cells have an affinity. They have 10 times the amount of receptors for sugar. So that greatly feeds. Again, the whole point is it's going to increase inflammation. And obviously, if your immune system's busy trying to fight off cancer, it's not going to be able to fight off other common viruses or the coronavirus that we're being exposed to now. So another key supplement would be to take a high quality multivitamin and mineral complex. Why? Again, because the COVID-19 virus in particular is triggering a systemic rapid inflammatory response. So key nutrients that you'll find in our men or women's multivitamin and soft tissue support system, the Edison pack, greatly reduces this inflammation because it contains not only higher doses of vitamins and minerals, but the best form of those vitamins and minerals. Again, when you buy a multivitamin and mineral complex off a big box store, they're going to use the cheapest form and dosing to mass produce the products. Plus, typically you'll see they're loaded with fillers, gluten, soy, corn, sugar, and other bad stuff. Our supplement also contains antioxidants, digestive enzyme, and probiotics, all of which are important to reduce inflammation and keep the immune system balanced. So I wanted to show you the back of the label just so you could see. Our supplement contains key things that have been shown through numerous studies that actually do reduce inflammation and help boost the immune system. Green tea extract, GABA, alpha lipoic acid, all of these things actually reduce inflammation. Turmeric root. When you look over here, garlic, ginger, probiotics, magnesium, zinc, selenium, chromium, all have been shown to help balance and give the immune system exactly what it needs to function properly. So again, you've got to make sure you're taking something of a higher quality. Nutrition action steps. So these are the key action steps you need to be taking right now. Eat healthy fats like we talked about. Eat more nuts, seeds, avocados, coconut, and olives. Those are all awesome fats. Eat healthy proteins. You need to eat organic, grass-fed beef, free-range chicken, and free-range chicken eggs. Those not only are healthy proteins, but they also contain healthy fats. Eat a low glycemic or low sugar food. So anything that ends in the word berry, blueberry, raspberry, strawberries, Granny Smith apples, those are all really low on the glycemic index. Again, so we're not going to get those spikes in glucose, insulin, cortisol, those other stress hormones. Remove all the white stuff, sugar, bread, pasta, obvious forms of sugar, candy, donuts. Eat lots of veggies to increase your fiber intake and boost your vitamins and minerals. Cruciferous vegetables, what I call the smelly ones, are the best ones to go with. Cabbage, broccoli, onions, garlic, cauliflower. What's also key about these that they're seeing in particular right now with the coronavirus is that in particular it raises interleukin-6, your tumor necrosis factor, which are different cytokines released by your immune system, and this has the opposite effect. It actually can block those and decrease them. That's why we want to eat these types of vegetables in particular, because they're going to help to reduce that inflammatory pathway that this virus is causing. So key supplements. There are a lot of other supplements that you can take, and we'll be talking about these as the weeks go. But I wanted to just really focus on these core three. For one, because what we typically see are these are the ones that people are not taking and they are absolutely deficient in. So again, getting your daily dose of 5,000 IUs of vitamin D3, taking a good quality multivitamin mineral complex. But ours in particular is giving you the benefits of all the other things: zinc, antioxidants, probiotics, garlic, turmeric, ginger, and all in one product, which is great. Taking a good quality omega-3, again, that contains EPA, DHA, and MCT. And again, you can order these directly yourselves online, have them shipped right to you. And if you need help doing that, we will absolutely help you, but you can see the link below on the screen. Other lifestyle strategies: sleep, stress, and posture. These are all going to be key. There's so much information that we could cover about how to keep your immune system healthy, give it an extra boost right now. So we're going to break these down into other workshops and talks in the coming weeks, just so we don't kind of overload you with everything that we're trying to cover tonight. And that's why I'm going through it a little bit quicker, is just because I know we're going to be just covering these individual things in more detail over the weeks as we go. So sleep, you've got to get enough sleep. This is important. Science shows that sleep actually helps your immune system create memory. Okay, that is the whole point of an adaptive immune response. It's to create a memory, just like when you were little, you got the chicken pox, your immune system creates a memory so that if you come in contact with that virus again, odds are you don't actually have any symptoms, let alone it really doesn't create any problems, because your immune system has created a memory to it and knows exactly how to attack it. Now, what you can see over here, what I want to point out, is that when you have just acute sleep deprivation, so even a couple nights of not getting what science tells us is really supposed to be 8 hours of sleep, automatically it actually reduces that adaptive immunity, which we don't want. Chronic sleep deprivation, again, what does it do? It increases inflammation. And so we don't want that. We don't want to be going down an inflammatory pathway. Inflammation is the root cause of every underlying disease process, whether it's an autoimmune disease, whether it's arthritis, whether it's pain, inflammation is going to be present. So sleep actually does enhance your immune defense by utilizing your nervous system to communicate with the immune system. When you sleep, the part of your nervous system that dominantly should be taking over is called the rest and digest, your parasympathetic system that allows you to digest food, create this immunological memory, and actually allow the body to rest. Whereas the other part of your system, when you're up and awake and alert, can be more of a sympathetic, what we call fight or flight, so that's stress mode. And so you don't want to be locked in a dominant stress mode when you're actually trying to sleep, recover, and heal. So sleep allows your body to send energy-rich fuels to your immune system, and that's why we need it. So science supports 8 hours of sleep. We need the room to be completely dark like a cave and cool in temperature like a cave. And do not watch negative TV shows. Don't fall asleep to the TV. You got to get rid of all the light, and don't watch the news before you go to bed, because it's going to trigger your sympathetic stress mode. And that's why we see a lot of people, they have a hard time falling asleep or staying asleep, because again, these stress hormones are being triggered when they're supposed to be sleeping and not be present. So now we need to manage our stress. Part of how we can do that: pray, journal, write down things you're grateful for. These are all things to just keep reminding yourself about, surrounding yourself with positivity, right? Watch funny movies, watch funny TV shows. A lot of people now, they're working in their gardens, they're cleaning out stuff, they're going through old pictures and things like that. Just create an environment where you can surround yourself with positivity. And the number one thing too that you can do to decrease stress is actually exercise. So part of that, when we talk about posture and your immune system and how this relates, is because posture and movement are key to how your body functions and heals. And so what controls your immune system is your nervous system. That's your brain, your spinal cord, all the nerves in your body. Well, where does that live? Your brain lives in your skull, and your spinal cord and nerves live inside of the spinal column. It is key that you have good posture. Unfortunately, what is also happening now is that a lot of people, they're out doing yard work, which they're not used to doing. They're up in their attic, or they're just blatantly sitting on their couch, watching the news and not moving. The gyms are closed, everything's closed. So your routine is different. And if you didn't take care of yourself before, odds are you're probably not taking care of yourself now. So we need to do something. We've got to move. And what's fascinating chiropractically, and why we always talk about this again, is because a spinal adjustment, they've actually done studies on people with full-blown HIV, with AIDS, and showed that when they received chiropractic care, their immune system actually increased compared to those people that did not receive chiropractic adjustments. Plus, when you look at this quote down here below, Nerve fibers go to virtually every organ of your immune system. Why? Because the nervous system, the brain controls everything. The nerves are the pathway. So in order for your spleen, your lymph system, the blood flow, all the organs and tissues, your thymus gland, your adrenals that are linked with your immune system have to be connected to the brain to do that. And so when you get an adjustment, you actually do get a boost to your immune system. We understand that a lot of people right now, they're not coming into the office because of what's going on. So it's key that when you're not, even though we are open, we're considered an essential healthcare provider, but some of you are not coming in right now. It's key that you keep moving when you're at home. I would tell people, don't sit longer than even 15 minutes before you get up and walk down your hallway. Make sure that you're actually doing things that are going to create movement and have good posture. Now, part of posture, especially you can see this picture here, why this is so important is because now naturally you're probably on your phone right now, and if you're looking down at your phone, and what creates forward head posture, it can literally increase the weight of your head to up to 60 pounds for every inch your head comes forward in front of your shoulder and pelvis. The problem with that is that not only can it result in pain, headaches, abnormal blood pressure, pulse, but what do you see here? It even reduces your lung capacity, because the more weight, it actually creates more stress and strain to the joints of your neck and rib cage area, the mid spine. Okay, so bare minimum, if you're going to be on your phone, hold it up at eye level, and make sure that you have good posture. Get up and move every 15 minutes. You can do these exercises you see here, plus there's many others, and we're going to be talking about these in the coming weeks. And if you can, you're going to take a picture of the screen, maybe take a screenshot if you're on your phone of the screen. But these are some exercises that are really going to help counterbalance that forward head posture. Because again, a lot of us right now, if you're out at home, you're watching TV, you're on your phone. So again, you got to be doing things that are going to counterbalance some of the bad posture to make sure there's less stress on your nervous system, which again then means less stress on your immune system and less inflammation, which is what we want to accomplish. I want to thank you guys so much for being here tonight and going through the information with us. We know that probably just naturally you can have a lot of questions. We absolutely are doing our best to answer all the questions. And if you've got any further questions, I'm going to put up a slide in a second to show you that contact information that you can get a hold of us. We are here for you, and we're going to keep bringing you information in the coming weeks just to keep moving everybody forward, and most importantly, keep everybody engaged so that you don't have to feel like you're isolated and alone. So again, we want to thank you for being here. Obviously, if you watched on Facebook, you have already liked our page. But again, stay connected to the page by clicking that you want to follow and see updates. We're just going to keep giving you information so you can learn more about how your body works and what you can do to take the best care of yourselves, to stay calm, stay smart, and we're going to keep moving in the right direction. So again, if you have additional questions, you can text us at the phone number you see there, message us directly on Facebook. Again, the link is there as well if you'd like to order your supplements online and have them shipped to you. And just remember too, we are considered an essential healthcare provider, so we are open and we're doing our best to accommodate everyone with their adjustments. So we want to keep you moving in the right direction, keep you healthy and well. Again, I want to thank you guys so much for being here, and we'll look forward in the coming weeks for the next workshops that we'll be having coming up.